Welcome back. On section 19 of the Anatomy Review Online, we're going to look at the imaging of the upper limb. Now, we've already done a little bit of this, but I think it is worth taking a little bit of your time to make sure that you understand and can specifically find the major structures associated with these images. Here you can see an anterior view of the clavicle. The shoulder has the clavicle, acromion, coracoid, glenoid, scapula, and humerus, all labeled in here. And you're also going to have the 3 dimensions of the posterior shoulder in mind as well, since this is going to be superimposed through 2 dimensions. So looking at those structures that are labeled, we now go to an image, and you can start to see this AP of the shoulder. You can see a clavicle along with an acromion, the greater tuberosity, and the lesser tuberosity is a little bit more difficult to see, but you can kind of see that the head of the humerus has got a cumulative density, and you can also see the glenoid, which has been encircled, and finally the coracoid. And the coracoid is a little bit shadowed, a little bit bigger than it normally would look compared to the other structures around here, and that's because of the shadowing. Since this is an AP, the shadowing of this anteriorly located coracoid has been further away from the pickup film, therefore it's distended slightly by shadowing. In an axillary view, it's a unique view to try to get underneath the arm, and this is kind of the way that you're looking at the scapula from below. So the inferior angle is closest to us on this, whereas the acromion and the coracoid are further away. So here you can see this axillary view, and you can have humerus, the coracoid again a little bit distended from shadowing. The clavicle is a little bit more distended from shadowing, and there's the acromion. Notice the glenoid fossa has a very oblique view of the fossa itself, so it's kind of foreshortened. Lesser tuberosity is very plainly seen in this view, however. So this is an inferior anterior dislocation of the humerus, and we've seen one like this before. They are oftentimes accompanied with rotator cuff tears, and it's important to note that you can't really see those soft tissues in this plain film, but you may be able to see those soft tissue tears if you had an MRI. Oftentimes you can detect these tears through active-passive resisted testing of the joint anyway, so the MRI, though it may reveal what you suspect through testing, a good physical exam will do the same thing for you. When you look at the elbow, you have the anterior and posterior view with the various structures from lateral epicondyle, capitulum, and radius, over to the ulna with the trochlear notch, and then the trochlea itself, and the medial epicondyle, which is going to have the ulnar nerve coming across that. Posteriorly, you have the lateral side with the lateral epicondyle and the olecranon fossa for articulating with the olecranon process during extension. That radial head, which will have the annular ligament going around it, and then of course the ulna and the medial epicondyle. In the film view of the elbow, you see the shaft of the humerus oftentimes has a lucency right down the center of it. Notice how the bone, because of the curvature to this, tends to have a very thick-looking cortex to it. And if this starts to thin out a lot, that can actually be a good indication that there may be osteoporotic change. So this looks like a nice, healthy, young bone. What you can see, this medial epicondyle sticking out much more prominent than the lateral epicondyle. The olecranon has been superimposed over top of the trochlea, and you can oftentimes see the olecranon fossa. In some images, you'll actually see a hole through that olecranon fossa, so don't be surprised if that's the case, because it's very thin bone in this AP view. You can shine right through it with the radiograph, and it will actually look like there's a hole or something missing there. That might be normal. Then you have the superimposition of both the radius and the ulna, because this person must be in a semi-pronated position where the radius has crossed over the ulna. There's the coronoid process for the attachment of the brachialis muscle, and there's the radius with the head, the neck, and the tuberosity, and that tuberosity is going to be serving as the attachment point for the biceps tendon. In the lateral view of the elbow, you want to be aware of the superimposition of the two condyles on the humerus, as well as the overlay of the radial head and the ulna. So we look at this lateral view, and you can see here how the ulna has been animated. We'll get rid of that, and then you can see the shaft of the humerus. Now it starts to narrow out, so this kind of set of lines that you can see coming off of the posterior aspect along to the anterior aspect is because of the supracondylar ridge, and does not indicate any kind of fracture or dislocation. The trochlea is more anteriorly oriented, and the round circle that you can see inside of that is actually the superimposed capitulum, which is head-shaped. Finally, you can see the shaft of the ulna and the shaft of the radius, and that ulna will come back to the olecranon. There's the head of the radius and the radial tuberosity. Notice that this forearm is in anatomical position, which would be supinated. The anteriorly located coronoid process is not that easy to see, but if you follow the lines like we have with this outline, you can now see that it's projecting up from the trochlear region. In this slide of the wrist, in a palmar view, we'll review the bones of the wrist, and if you're not sure of that first row, then review those on your own. Wrist view here, you can see the first row of carpal bones with the scaphoid, lunate, triquetral bone, and then the overlying pisiform bone. In the second row of carpal bones, we'll look at the distal trapezium, trapezoid, capitate, and hamate. Those in the X-ray again, where you can see the trapezium is with the thumb. The trapezoid is a small square one on the second digit. The capitate looks like one of those Easter Island statues and hammers right down in the midpoint of the scaphoid. And then finally you can see the hamate with the hook of the hamate outlined in a little bit darker cortical bone because of the projection that it comes out from the wrist. That will conclude our look at the imaging of the upper limb. In our next segment, we'll look at the imaging